One of the most important health tips I can give you, especially if you're not feeling good, is to check out your body temperature. Now, generally, if your temperature is low, you won't feel your best. Our enzymes have a range of temperature where they operate at their optimal level, and that's around 98.6 degrees Fahrenheit or 37 degrees Celsius. When enzymes don't function optimally, then our organs don't function properly because enzymes catalyze nearly every biochemical reaction that occurs in our body. So your temperature can be a marker of the slowing of metabolism. And this is often brought on by the stress of an illness, injury, or emotional trauma. Now, this is a well-known reaction in our physiology that is hardwired in us for survival. So in the stressful situation, the thyroid hormone T4 is converted to reverse T3 instead of the active T3 hormone. Now, this actually blocks the thyroid hormone receptor, resulting in metabolism and temperature being low. You might think of it as a state of hibernation. Now, the temperature can also be low because of low thyroid hormone levels. Now, this is hypothyroidism, but many times it's low even when the thyroid blood tests are normal. Now, I've found that low temperature has been in hundreds of my patients over the years, and they've complained about a multitude of different symptoms. Some of these symptoms of low body temperature could include one or more of the following: heat or cold intolerance, weight gain, PMS, fatigue, depression, anxiety, panic attacks, headaches including migraines, hair loss, constipation, carpal tunnel syndrome, muscle aches, irregular periods, brittle nails, dry skin, poor memory, fluid retention, ringing in the ears, acne, asthma, bad breath, allergies, insomnia, itchiness, slow healing, irritability, low sex drive, dry eyes, and there are even a few others. Now, if you can imagine the number of drugs your doctor might give you if your blood tests are normal, but you have some or all of these symptoms. In my experience of many years of treating patients, when someone presents with any of these symptoms and we find that there's a low body temperature, it can many times be treated and corrected by using Wilson's temperature syndrome protocol. So if you have any of these symptoms, get an old style shakedown thermometer and test your temperature. Now, I recommend checking it 3 times a day and figure out the average over several weeks and use this average as the basis of whether or not your temperature is low. Now, this can be done 3 hours after you get up, 3 hours later, and then again 3 hours later. If it averages low, and by that I mean about a half a degree or more below normal, and you don't feel your best, like you have some of those symptoms I mentioned earlier, see a natural medicine physician. WilsonSyndrome.com has an ebook that you can read for free, and it gives you a lot more information about the diagnosis and treatment of this condition. This is Dr. G. Thanks so much for watching.